to you this evening. Fourth case of monkeypox in the country has been confirmed in Delhi. Importantly, an individual who has no history of international travel. The affected individual is being treated at Delhi's LNJP hospital. The Delhi government has formed a special medical team to tackle the monkeypox threat and has assured citizens that situation is under control. The 3 earlier cases, all in Kerala, have been detected in individuals who had arrived from the UAE. Beyond this, there is a suspected case of monkeypox in Telangana as well. A 40-year-old has travel history to Kuwait. He's under scrutiny. So we are trying to figure out what really are the symptoms of monkeypox. How is it that you should know if God forbid this disease comes knocking to your doorsteps? What are the things that you should watch out for? Symptoms typically shows as fever, rash, swollen lymph nodes. So if you have any of these, of all of these, be sure that you get medical aid. Symptoms resemble smallpox, but they're less contagious. That's something that should give you a little bit of hope. They're not that contagious. So these are the symptoms. The symptoms last anything between 2 to 4 weeks, depending upon what your immunity level are. Mostly not severe, but recent fatality rate is 3 to 6%. Close contacts with infected person or animal could be the reason why it spreads. Contact with contaminated material, if you're using the same bed, using the same linen, that could be a reason for spread as well. Lesions, body fluids, respiratory droplets, all of this could carry the virus further. Who's at the highest risk? Newborns, young children. They are the category who are most vulnerable. People with underlying immune deficiencies are also vulnerable. They are the category which are at highest risk as far as this disease is concerned. So, if you are a health worker, of course, health workers are at risk constantly for any disease. So if you're a health worker, there's a problem. How can you protect yourself? Clean and disinfect possibly contaminated environment. Stay informed on monkeypox in your area. Hold open conversations on symptoms. Don't hide it. On infection suspicion, isolate and get yourself tested. That's very important. Don't hide yourself. Get the medical aid that is required. One vaccine specifically approved to prevent monkeypox. So if your question is if a vaccine is available, the answer is yes. Antiviral agent developed for treatment, now licensed. So there is hope. There is a vaccine there on the anvil. Smallpox vaccine provides protection as well. So those are the questions as far as what really you should be looking out for now when monkeypox is spreading. But to understand this further, Dr. Narinder Kumar Mehra, former Dean of All India Institute of Medical Sciences, is here with me. So first thing first, this is looking like deja vu. When COVID outbreak began in Delhi, if you recall, the first gentleman who got admitted to LNJP, he had a birthday party for his child, and even then people were not very sure what was happening. Same trajectory, 3 people, 4 people. In the case of COVID, it suddenly burst. Do you see something similar for monkeypox?
Well, as you know, the first case in India was reported on July 14, and by in about 10 days' time, we already have 4 to 5 individuals who have been confirmed to have the monkeypox. I would say that is not much to worry, but one has to be very careful. Everything seems to be under control. The ICMR has immediately come into action. They have already, the National Institute of the National Institute of Virology has already actually isolated the virus. They have even sequenced the virus, about 179,000 base pairs, which means that we are well on our way to also have a good vaccine as well. They have also immediately sort of trained 15 laboratories all over India, making sure that they are in all regions of India.
Okay.
And they have already also shared their reagents as well. So I think one has to be very careful, and you have stated it all very, very well, how to be very careful. One has to be careful. The disease can last between 2 to 4 weeks. The severe cases can occur, but not as many.
Right.
We have already learned a lot from our COVID experience.
So I have 2 very quick questions, if you allow me to come in on that. First, is this fatal? How we saw Delta of COVID, and that trauma is still there in the minds of people. Hence, this question that people are asking.
Yeah, monkeypox is known to be less contagious than the smallpox. Less, of course, much less than the COVID actually. But it also known to cause very less severe illness as well. But one has to be careful. I don't think there are anything that is there to worry about.
Okay.
But I'm again and again saying one has to be cautious.
And my last question, sir. And my last question, like we said, one of the most vulnerable populations seems to be newborns, small children, young children. Again, to draw a comparison with COVID, schools were shut down. Parents were told, keep your children indoors, don't send them to the park. And it had disastrous effect on their mental health. I hope we are not going to see anything identical.
No, I don't think we are going to be seeing anything of that sort so far. Everybody has reacted very well. Everybody has taken action. WHO has already declared it as a public health emergency of international concern. So, I mean, we do see that there are about 17,000 cases have become known, and that is also in about 75 countries. Mostly, this monkeypox is known to be in Central African Congo. Is a country over there, and also in the West African states.
All right.
But it has now come to many countries now. That's the cause of worry.
All right, Dr. Mehra, I'm afraid I've completely run out of time, but I'm sure we'll have this detailed discussion another day. Thank you so much for joining us and clearing all our doubts. If you want to know more, you can listen to that conversation and see that broadcast once again on news18.com. That's all that I have time for. Shivani will join you next with all the other news and updates.